Thank you very much for asking me about myself, what I do, and why I chose it. To a certain extent, that's complicated and simple, all in the same, all at the same time. So, when I started off looking at medical careers, I always initially wanted to be an ecologist. I was more interested in biology, and from a pragmatic point of view, it was difficult at that time to find jobs. And I was a bit more academic, and so I went down more of the career pathway towards medicine. And what I found over time was I really enjoyed that. I became less academically and more clinically driven, less academically driven and more clinically driven, although that's changed a bit over time. So if I look back and think how I felt before going to medical school, I wasn't quite sure. I didn't have a particular career goal in mind, and that remained during my time at medical school. I initially did a pharmacology intercalated degree, so I felt a little bit more medical. I did placements in HIV medicine, and I thought about doing hospital medicine and a career in the medical field. But I really enjoyed surgery and orthopaedics on my orthopaedic placement, and got teaching hospital jobs in surgery rather than medicine. I then ended up being the first house officer for a gentleman called Professor Cobb, who basically mentored me, and that's one of the reasons why I went down a surgical pathway. Surgery at that time was organised differently, and you did placements rather than a rotation. So there weren't tasters and other things, so you had to make a decision about whether you wanted to do a surgical pathway, a hospital pathway, or different things. So that involved being a demonstrator for a year, which I enjoyed with teaching. That involved working in emergency departments, which I think is a good way of starting to think about what you might do later on, because it touches on all aspects of community work and also all the specialties within the hospital. I did my training in London. I did my orthopaedic training at the hospital I trained at. I really enjoyed it, and I was a consultant at UCL before moving up to Burton. I have been associate medical director. I've been college tutor. I've gone back to doing more in the way of research, and that's more of my career pathway now. I'm what you would call an academic orthopaedic surgeon. So surgery to me is another skill. When I was thinking about why surgery, it was all about what skills would I have to treat my patients. So being able to operate gives you another armamentarium when treating patients other than medications and all of the counselling skills. What I found as a consultant is I do very little surgery. I do more organisation and more counselling for patients. I conservatively treat 90% of my patients, maybe 95%. So how you feel about things and how you manage patients later on in life becomes quite different. So surgery is another way of just helping manage patients. Equally, doing things like anaesthetics or obstetrics and gynecology will give you other skills. So I'm fairly long through my career. When I was thinking about this interview the other day, I've only got 1/5 of my career left. So I've done 4/5 of my career. I've done my training. I've been a consultant for some time. I was told wistfully by a more senior colleague once that you only really start your training when you are a consultant or a GP. And that's probably true, because the responsibility then lies with yourself. So your decision making and how you feel about your career will change at different times. The other bit is don't worry too much. Opportunities arise at different times, and you have to look at those opportunities in the light of your skills and your desires and your work-life balance. So orthopaedics expanded their numbers at the time that I was looking for jobs. At the same time, obstetrics and gynecology hadn't had an appointment as a consultant for about 5 years. So if you were on the obstetric pathway, you weren't becoming a consultant anytime soon. So getting to the end point on your career ladder can be difficult if there are no jobs available at the end of the day. So that's something to think about. Orthopaedics is a fantastic specialty. It's evolving, it's dynamic, it has some of the best research in it nationally, driven by patients and industry. There's all sorts of jobs that you can do within orthopaedics, and it's from cradle to grave. The youngest patient I've seen has been weeks old. The oldest patient fell on the QE2. She was 106. I fixed her shoulder and I fixed her hip. So there are lots of opportunities within orthopaedics for training. Are there any drawbacks? In my mind, not really. But I invest my time and my passion within what I do. So, and I hope that comes across. You must enjoy what you do fundamentally, and I do. So it gives me a smile on my face, thinking about how I can help patients. And generally, I have a great team around me. We've been through the COVID pandemic. It's like having a family. You have good days, you have bad days, but you work with your team to try and help other people, and that's a great thing to do. So don't work in isolation is another thing. Work with a team, and you have to find the team that fits well for yourself. Would I do the same thing again? I don't know. At one point, I was almost a neurosurgeon because I worked at Atkinson Morley's. They like me, I like them. That's a very different life choice. But as I said, it's all about the opportunities that you come across. Any additional advice that I can give you? Follow your heart. Be open. Think about yourself. There are all sorts of reasons why you will choose a career. And it is about balance. I do all sorts of different other things, probably to extreme. I'm an ultra marathon runner, as well as having written 100 papers, and it's a question of what you find interesting in life. I've got a family, and I invest my time in them as well. So balance your life, enjoy yourselves, and never have any regrets.